Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Steve here with us this afternoon. Steve's down here from New York City, and he came down here after watching our YouTube videos. He's felt like his body's been out of alignment, correct?
Yes.
And he's had some right pelvic pain, hip pain out here, and hamstring tightness bilaterally. A little bit of tightness up here between shoulder blades and mid-back. And he's also had some left TMJ pain, so I'm going to show you how to adjust the TMJ joint today. So we've already done his orthopedic neurological evaluation and history, and I'm going to have you go ahead and close your eyes, Steve, and flex your head forward and backwards, and we're just going to give him the highlights here. And back to neutral. Now see, I can tell he's a side sleeper just by his posture. His head's a little forward and translated to the left of center. He's got a little more room here on the right than the left, so his pelvis has shifted a little bit as well. Okay, so I'm going to have you lay on your stomach here now. Put your face right down in there. Since this is his first adjustment here to Advanced Chiropractic Relief, I'll put him on the BioPhysics table. I see his left leg is shorter by about 1/2 inch. And then when I bring the legs up, it gets actually about 1/2 inch longer, and that tightens up in his low back pelvis and also his thighs, his anterior quads here, tightened up. And he's got bilateral SI joint subluxations. His pelvis is higher on the right side, which makes his spine curve out to the left down here in the thoracolumbar region and then compensate back over up in the upper thoracic region to the right. If you watch my hands here, you can actually see the curve to the right in his upper thoracics and then down to the left in his lower thoracics. Yep. So, palpating him, he's got L5 subluxated right down here on the lumbosacral region. Now, his spine's more hypertonic here on the left at the convexity of this lower thoracolumbar scoliosis, and then a little tighter on the right up here on the right convexity of the right thoracic scoliosis. In the upper thoracics, his lower cervical's out on the right there, on the right at C3-4. So I did a sacral deviation test on him. Go ahead and lift your right leg up. Okay, now do the same thing on the left. Yeah, it seemed a little different on the right side to me, did it you?
Yeah.
Okay, so he's got a little bit of a right sacral deviation, which makes sense with him having the right hip pain as well. That old adage about the ankle bone connected to the knee bone connected to the hip bone, that's all very true. That's why I adjust the whole body as opposed to just segments of the body, because I want to lock your entire frame up structurally, because that then retrains the musculoligament system to hold it, which is the soft tissues of the spine and the extremities. And then we're also retraining the mechanoreceptors in the nervous system and the autonomics to fire off proprioceptive neurological bombardment. There we go, good. Okay, just relax this one. Okay, there it is. That was a rib. So we're going to recheck his legs now. The legs are exactly even now, Steve. Tell me if this one feels any smoother to you than the first one did.
Absolutely.
Okay, good. His legs still got a little bit longer on that left side when I brought it up, so that's just showing that he's got some muscle adaptation down in his SI joint region. We're adjusting the curve back into his cervical spine with this one, and going to put his entire head up and over his shoulders. Just turn you on your back now, please, sir. There we go. Good. Now let's slide down this way about 1/2 inch. Put your arms straight out to the sides, palms facing up. Good. So I've adjusted both his AC joints, his sternoclavicular joints, and his costosternal joints with that one. Just relax your whole leg here. There you go. Should have felt that one.
Absolutely.
From your knee all the way up to your low back. Let this one go limp. Yep. Good job. Let's sit you up, face that way. There we go. So how long have you been a crack addict?
About 2 years.
About 2 years, huh? And what made you finally decide to make the trip down here from New York to get adjusted?
You know what? I just didn't want to hesitate any longer. Watching your videos really convinced me that you're the doctor that could really help out this issue. So.
Oh, thank you.
Yep.
And Steve mentioned to me earlier that he learned a lot from our videos. That's why we first started doing these, is to educate the masses on the benefits of chiropractic care. And I'm happy that he says he learned some things. Let's come over here and lay on your back now. Because that's the entire purpose of our videos. I know y'all want to see me pull somebody's head off doing the ring dinger, but not going to happen. Slide up under that just a taste.
Slide up?
No, you're good actually.
Okay.
I thought you needed to slide up a little bit, but that was the top of your hip. It's going to feel tight.
Yep.
Now this is your very first time getting decompressed, correct?
Absolutely.
That's my job. No cracking allowed now, stop me doing it. There we go. Okay. There you go. Boy, that was a definite home run. Felt that all the way down, didn't you?
Oh my goodness.
Yeah.
Wow.
Yeah, just relax this right in my hand here now. Okay, let me have this one. Move your right big toe. Okay, I still got one. Why don't you tilt your ear to your right shoulder? Okay. Relax this now, let it go. Okay. You're a little bit on the tight side of your neck.
Yeah.
I think you were just anticipating me. Works better when I do it though. Alright, let's kind of get up sideways and come over here and stand in front of the mirror now. Okay, so I'm going to have you close your eyes and flex your head forward and backwards again. Remember how this feels. Back to neutral. Wow, take a look in the mirror right now. Look how squared off you are.
I feel different.
Yeah, you're definitely standing up taller. Pull your shoulders up and back. This is your homework. Flare these here. We're going to bring your head straight back and then look at the wall behind you. Yeah, full extension. Now, he was pretty tight in his cervical muscles, so relax now. Yeah, I'm going to stretch you forward here. I'm going to bounce your muscle spindles in the trapezius and the levator scapula and rhomboid muscles here. This will lengthen these fibers and recalibrate these. Good, okay. Now this time when you go forward and backwards, Steve, tell me if this feels any different to you than the first couple.
Much different.
Should have felt like it was on a swivel that
Absolutely. Not as tight.
Yep, good deal. So this is your very first treatment here at Advanced Chiropractic Relief. You're going to be here with us all week.
Yes.
So we'll probably do another video with you on Thursday to let people know how your week went.
All right.
From watching our YouTube videos, did this meet or exceed your expectations about what you were going to get here?
Absolutely.
Did you get the same thing that you saw when I was doing the YouTube videos?
Definitely. The ring dinger was definitely something I anticipated. Was a little bit worried about.
Yeah.
But no, it was. I'm glad I did it. And to anybody that's experiencing similar issues, I would definitely recommend to come to Dr. Johnson. He will help you out.
And you came down here really on a preemptive basis to keep yourself from having more spine problems as you got older.
Definitely.
Which is the smartest thing to do. You should catch problems before they get on top of you and you've already had back surgery or neck surgery, because you've seen all the patients we take care of that have had failed neck and their back surgeries. So it's much smarter and better to take care of your problems preemptively like Steve's done, as opposed to waiting until it becomes a problem for you. So if you have neck and back problems, go to our website at advancedhoustonchiropractor.com and fill out a new patient request form, and Renee will get back to you as soon as possible and get you an appointment. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, and we'll see y'all soon.